Here we go. Good
evening.
Morning.
Good morning from Australia. Oh, I've just asked my boss for a pay rise because I deserve it. But now I've got this terrible pain in my stomach. Dr. Dion is going to talk to us about this. Welcome to all of you. And I'll hand you over to Tova to introduce Dr. Dion.
Shalom. I'm Dr. Tova Goldfein. We're in Israel tonight and streaming from Australia in the morning. We are global at TMS RoundTable. My name is Dr. Tova Goldfein. I said that already. And I am a mind and body pain specialist, treating chronic pain, stress disease, and working with many amazing people to help them help themselves. So usually in the start of the show, a little bit in the beginning, we take a few minutes and Rose helps us through a short meditation because we're all learning mindfulness. We're all working with it. You're not alone. And so Rose is going to take us through.
So if we just hold ourselves quietly in our bodies and be aware of our bodies, maybe close our eyes and be aware of our jaw and our face. Be aware of our shoulders. Release them if they're tight around the neck. Be aware of our back and how tight it is as you mentally hung down it. Be aware of your hips. Release them. Allow your legs to go free. Just quietly breathe in and out. In through your nose, out through your mouth. Allow your stomach to go up and down with your breath. Once more, in through your nose, hold, out through your mouth, release. Now we welcome Dr. Dion.
Dr. Dion Nowoweiski is a specialist in the treatment of gastro disorders and chronic pain and anxiety. He has studied with many doctors and participated in a lot of research with eating disorders, along with chronic pain and childhood trauma. We are so happy to have Dr. Dion here and have him share a little bit about his work. And after that, I really am excited to have you ask questions and we all can answer. Before Dr. Dion says something, Rose, just introduce yourself.
Oh, Rose Hoey. Oh, sorry. Rose Hoey. I'm a psychotherapist and I practice intensive short-term dynamic psychotherapy, for short ISTDP, and I trained under Dion. And Dion also helped me when we ran Michael Galinsky's All the Rage program in Melbourne. Dion was the person that answered the audience question. So welcome, Dion.
I just want to say one more thing before Dion speaks. I think the reason why I stuttered and said my name twice is because Dion is such a funny person, and I expect that we'll all secrete a lot of endorphins laughing, and there'll be natural painkillers, so stay with us. Welcome, Dion. Good morning.
Good morning. You've already hit the nail on the head. You mentioned the T word, trauma. It's very connected to our stomachs, and we tend not to realize how trauma manifests itself in the stomach and where trauma goes when it doesn't get processed. Quite often when you're a little kid and you're having a hard time at school and somebody in the schoolyard, didn't realize you wanted to play with them and you sat for the rest of the afternoon, for the lunchtime by yourself, wondering why nobody likes you. And then you go home, you have dinner, you go to bed, you wake up in the next morning and you say, "Mummy, I've got a stomach ache. I don't want to go to school today." And then it becomes a pattern that entrenches itself in our lives and our bodies. And we begin to realize that we can hide our real traumas, our emotional traumas, by expressing them physically. That's just a small example of what happens to us every day, when we're little. And we don't realize that the pattern that it's creating within our bodies is setting up a life of manifestations of pain in physical symptoms. I'm sure we can all relate to these experiences very easily from our own childhoods without having realized the significance of these small events when we were younger. In the work that I've done with patients in the inflammatory bowel disease clinic where I worked, I saw a lot of people who had been diagnosed with either ulcerative colitis or Crohn's disease, and some of them from a very early age in their lives. And that in itself created another kind of trauma, almost a medical trauma for people, a chronic health problem, without any known, emotional cause. And for some of these diseases, a lot of these diseases, there doesn't have to be an emotional cause to them originally. But along the way, I saw a lot of people who the emotional impact of their health very much became intertwined with the manifestation of their symptoms, with how their symptoms presented and what kinds of things used to make their symptoms flare up. And the term, having a flare up was a very common term used by the doctors in the gut clinic. And they would talk about a flare-up. And what I was finding with the patients that I was working with is the flare-ups usually coincided with an episode of something that triggered anger in them. An injustice of some kind, a misunderstanding of some kind. Something that created a problem for them that they didn't recognize as painful. So a lot of what happened, sorry, just a lot of feedback here at my end. So something that was innocuous ended up creating, anger in them, and they would have a so-called flare-up in their ulcerative colitis or their Crohn's disease symptoms. Working with these patients, we were able to realize that, the anger would sometimes go into the bowel. And I think one of the patients that I was working with coined the term, I've got an angry bowel today. It was a really interesting experience, and a lot of people would, I learned a lot about how people used their stomachs, their GI systems to communicate what was going on inside them emotionally, because emotions are pre-verbal. They're there from the beginning. I say to patients a lot of the time, when you were born, did you know how to breathe?
Good point.
No, nobody taught you how to breathe. So did anybody teach you how to feel? No. It's innate. We just know how to feel from the very beginning. It's like breathing to us. But over time, we try to teach ourselves not to feel. And the impact of that is something that we don't account for at the time. We don't recognize that teaching ourselves not to feel our feelings can have consequences. In fact, I was with somebody yesterday and they were saying, not feeling means I'm strong. It means I'm in control. And that's a good thing, isn't it? And then we had to, we had a conversation about the consequences of not feeling. And we have to help people decide, is not feeling your feelings worth the pain that it creates in our bodies? And our stomachs are one of the, signals that our bodies use to teach us that we're in pain. I was training with a friend of mine once, and he said something about, he had a rotator cuff injury, and he said his physio said to him, go to the pain, but not through the pain. And that's good for a physical injury. Whereas, with our therapy with patients, what we're actually trying to help them do is to go through the pain. Because usually what happens is they start to go to the pain, and that's when they'll stop. And then they'll get their symptoms. And I'll be sitting in a session with somebody, and we'll be talking about something from the recent times or from the past times that was a painful experience for them, and all of a sudden we'll hear some gurgling sounds in their stomach. And some of the acids in their stomachs, or the lumen in their stomach is starting to create excess fluids or starting to create gas. And you can hear their stomachs start to manifest anxiety and stress and pain. And at that point, people have a decision. Do I stop here? Do I go to the pain and turn around? Or do I have to keep going through the pain so that I don't end up having to keep manifesting these symptoms in my stomach for the rest of my life? And it's a difficult thing to do, because we're taught, if something hurts, stop, turn around, go back. But one of the things about our emotions is they have the intention of getting felt. They don't want to stop from being processed.
That's what
they're for. And then we become in conflict with themselves.
Wow. What's really important to finish commenting, Dion, is, but we control the feel. Like, still the feelings are not like some outside force. They're inside of us. They want to be felt, but they don't have an ulterior motive. They want to be felt, and they want us to. Can you elaborate on that?
Yeah, of course they really do want to be felt. That's their whole job. That's their whole point of existence. If an emotion had its own brain, it would tell you the only reason I live is to be felt. And if you're going to try to deny me my existence, well, to heck with you. I'm going to keep fighting to try to come and be heard.
Wow. Talk about that. That's the key.
Yeah. Every emotion, believe it has value in itself. They are their own little individual people in us. And if we try to ignore them, we're ignoring essentially ourselves. And we're not setting up a good relationship with ourselves. So what we need to do is to respect and value ourselves by respecting and valuing each and every single emotion that we experience. But we get caught up in thinking that we're experiencing an emotion by calling it anger, by calling it sadness, by calling it joy, love, by calling it something, by telling you or Rose or somebody, this is how I feel. But this is how we think of our feelings. This is different to how we experience our feelings. That little baby that I was talking about who knew how to breathe, who, when it cried, when it was hungry, when it smiled, when it was happy, when it had that look of relief on its face, when it finally did its first poo, they're just emotional experiences that don't need words, because at that point in our lives, we don't have words. So emotions are a pre-verbal experience. They don't need words. We create words for emotions as we grow. And part of society, our development is we've used language to describe emotions. But one of the things that emotions can't be explained is with words. They have to be experienced. And just because we say, I feel angry, doesn't mean we're experiencing the emotion itself. So when the emotion is trying to communicate to us, there's something going on in our body, and we're ignoring that and trying to communicate it in a word or an action of some kind through aggression, for example, then that's not the same as the experience of the emotion. And it's going to keep trying to make itself heard, to allow itself to exist in us. And then we create a conflict within ourselves over, do I want to let this feeling be felt? Or do I need to push it down and be in control? Or do I need to hold on to it so that I don't behave badly? What do I do? And we can become, there's so many different messages in society, from families, from friends, from politics, everywhere in the world, about how we're meant to behave when we feel a certain emotion. But one of the things about the emotion is we're talking about the experience of the emotion, not how we express it. If we don't allow ourselves to experience the emotions, the energy has to go somewhere. If it doesn't go out, it stays in. And then it comes out in angry bowel syndrome, or it comes out in other problems, butterflies in your stomach, pain, dyspepsia, constipation, diarrhea. The bowel is a very good communicator.
It
It'll tell you when you've ignored something.
Dion, would you sort of talk about how we judge our emotions as well? Because that's often, you were talking about pre-verbal, and while you were saying that, I was thinking then when we get verbal from 2 onwards, we then have that judgment kicking in. Could you elaborate a little bit more on that? Because it's from such an early age.
Yeah, I mean, it's children, 2-year-olds don't know the difference between being angry and being happy. To them, they're both acceptable states to be. But we inadvertently can teach our children that being happy is better than being angry. I would rather that you were happy with me than you were angry with me. Don't be angry. And then we start to send the message to our children that one emotion is better than the other one. Or that one way of behaving when you have an emotional response is better than another way of behaving. And, there are certain truths to how we want to behave. But one of the things we have to understand is that if we're sending a message to a 2-year-old that it's not okay to be angry, that 2-year-old doesn't differentiate between, it's not okay to be angry versus I'm bad for being angry. They just take on the idea of, well, there's something wrong with me. I'm bad. I'm not going to be loved. Or I could get rejected or abandoned, or something could happen to me. Something bad could happen to me as a result of me being angry. So I need to not be angry. But what do I do? Because, I want that toy on the ground and you won't let me have it. That's
right. And I'm punished for wanting
my emotions.
it. Yeah. That whole angry feeling when it wants to come up and then it's judged by an adult. It's sort of, they're taken back to that early stage, aren't they? Where it was too hard to speak their needs, I suppose. Yeah.
I mean, you look in the eyes of a young child when they're angry, and they have no fear of being angry. They'll look at you. They'll look at you and you'll know they're angry. You won't be in any doubt that they're angry with you. And, they're some of the happiest times of parenting that I've had, is that my daughter can stand there and look at me with anger in her eyes and be okay to express it with me as well. And because I would rather her be okay to be angry with me than to make her feel guilty about being angry with me and feel like she's a bad person or a bad daughter, or that I won't love her if she's angry with me. I want her to realize that she can be angry with me and I'll still love her. So that way she doesn't have to feel guilty about loving me and being angry with me at the same time, and then doesn't have to end up going, I don't know what to do with these feelings. I feel terrible about myself. I've got a stomachache.
Yeah. Well, your example of the little child at school was really good. I thought, because it's the next day, isn't it, that the child has the tummy ache, not that day. Exactly. So it's never connected. Yeah. And then they're taken to the doctor, and then they become a problem child. Yeah.
And then they get investigated for all these different medical tests, and they end up had children who have been investigated for medical tests, had surgeries, had bowel resections done, because they couldn't. So there was a young woman that I was working with who was in her early 20s, and she'd come from the UK when she was relatively young. The family had migrated to Australia, and her stomach problems, coincidentally, started about just after the time she migrated to Australia. She moved to a new school. She didn't know anybody there. She didn't fit in. She wasn't really accepted. Her family was going through financial difficulties after the move, so there was a lot of stress around. And she was complaining of stomach symptoms for a couple of months, and the parents, the mother ended up taking her to the family doctor, and the family doctor ended up referring to a specialist, and they were doing tests, and they could see that there was elevated markers, stress markers, and blood work and things like that. So they assumed, based on the medical evidence, that there was some kind of inflammatory condition, and put on, medications for the condition for many years, some of which have side effects. When I was working with her in the clinic, after about 3 or 4 sessions of work together, she was able to recognize that she had never processed her feelings about the transition and about what the experience of moving from one country to another country, where she was very happy to begin with, loved her life, was a happy kid, moving to another country, something that she didn't have any say over, something that she didn't have any input into the decision-making process, and something that she just had to go along with, that she couldn't express her feelings to her family about what that experience was like for her. On top of that, compounded by the move, and when she got here, and the difficulty she had with making new friends, and realizing that she was no longer popular and liked by many people, it created a whole different life for her. It was her trauma, but she had never identified it as her trauma, because she just looked at it as, well, that's just what happened. That was just how it went. And there was no point trying to talk about it, because I just had to do it.
Yeah. We've got some comments here.
Yeah, I don't see any questions, but Peg is saying there's some background noise coming from somewhere, which makes it difficult to focus, but I don't hear it. But I do hear me echoing.
Yeah. No, I hear a background noise.
Oh, I think I know what it is. Wait a second. Let's see if I turned my sound off. Let's see if it changes. Maybe that's it. Is your sound on your computer down? I might forget to do that sometimes. Forgive me.
Yeah. No, it's stopped now.
Yeah,
thanks, Peg.
There's a wonderful person named Mia Mustache. Mia Mustache says, so excited to hear all about the tummy stuff.
Okay.
Is that an old girlfriend of yours, Dr. Dion, or something like that?
Yeah.
Oh dear. One of the other questions that I would like Dion to maybe talk about is the fact that some of these people go on to have not just have GI problems per se, but they end up with anorexia type issues. Could you elaborate a little bit on that? Because there'd be quite a few people that end up that way and not make the connection, and the doctors don't necessarily make the connection.
Yes, obviously, when you've got stomach difficulties, you're going to think somehow it's related to what I'm eating. That's going to be one of the possibilities that you're going to look for, because you're going to try to find ways to try to settle your stomach down. You're going to try to do things so that you don't have to feel pain in your stomach. And then you think to yourself, let me see if I can identify a pattern. Does it happen after I eat? Does it happen after I eat certain foods? Does it happen when I eat at certain times? Does it happen when I, if I, don't eat enough? Or does it happen if I drink too much alcohol? Or, what's the pattern? So when we're little, and say talking like a 12, 14-year-old young person who's starting to have difficulties with things that are going on in their lives, they're trying to, they're dealing with puberty, they're dealing with peer pressure, they're dealing with pressure in the family or different circumstances, and they're thinking to themselves, I'm sick and tired of having this stomach ache. And most likely it's probably a stress-related or an anxiety-related stomach ache to begin with. And they think to themselves, I'm sick and tired of having this. I'm sick and tired of not fitting in. I'm sick and tired of not being looked at by the boys or the girls. So I'm going to do something to fix that. and I'll stop eating something. And then stomach ache starts to feel better. And is it because they've stopped eating something or because they feel like they're doing something to help themselves?
They're in control, in control.
Regardless of the attribution, the actual reason for it, there's only one thing that this person thinks of, and that is, I reduced my eating and that helped. And it creates the beginning of a pattern of when I start to realize I can make myself feel better if I don't eat. I'm in control, and I don't, and I'll be able to fit in, and it's going to help me be liked, and it's going to help me get rid of my stomach pains, and it's going to help me feel less anxious, and it becomes a panacea.
A whole story.
Yep.
A whole story.
Yeah.
A whole narrative.
Yeah. Wow. So Mia asked a question. I love that name, Mia. What if you're having your stomach symptoms since all your life? Not like your example that you have something remarkable going on, or all of a sudden develop symptoms. She's having some childhood trauma, and her symptoms since then, now at 31, they went into here she says at 31 they're worse. She's not working now. Could it be TMS? She's diagnosed with gastroparesis, pylori stenosis, and HEDS. Could it be TMS? Seems to be the question. You want to answer that, Dion?
Yeah, there's a possibility that it could be some kind of manifestation of unexpressed emotion. So the question then becomes, it becomes an investigation. We need to do the investigation to identify whether there are some hidden, unprocessed emotions lurking around in your mind that are waiting to be processed, that are trying to be processed, that are telling you through your pain symptoms, we're here, pay attention to us. There's something in here that we want to tell you about that you may not remember or may not want to remember, but is important for you to process.
And most important for all of our viewers and for everyone to hear over and over again is, even if you have something physical, number one, chronic pain and chronic disease is not normal. It's not normal. The body heals things. The body heals broken bones. The body heals. That's number one. Number two, the way you react to your condition, the way you react to your pain is a large percentage of what's going on. And that's where these tools can be so helpful. And what we're doing each week here is just saying to you, don't get stuck on the physical. It is what it is. But understanding your reaction to it is profound, and healing happens. So glad that you brought that up, Mia. And after the show, Rose and I, we answer questions also. So maybe we'll also elaborate more on that. So here's Oren's question. You want to read it, Rose?
I can't see it.
Oh, okay.
I've got pegs.
Okay, here's Oren. Oren's from Israel. I met Oren online. He's a psychology student, and he himself had a back problem, and he read the book and read some articles and he got rid of his back pain. So I'm happy to see you here, Oren. He says many approaches view emotions as not necessarily connected to the present situation, like conditioning. How do you reconcile this and the dynamic of emotions that call you to act on them?
Yeah, emotions are very much a condition. Our responses to emotions are very much conditioned. So it's if you think about Pavlov's dog and operant conditioning and those kinds of, theories, the patterns that we use to manage our emotions is very much entrenched in long-term patterns. It's something that is set up from a very early age. So how do we help people understand that there's a connection between the past and the present? Is by helping people understand that I am not just born today. I wasn't just, I didn't just get born when I woke up this morning. I'm a person with a long history, and that experience, that history, shapes who I am today. So all of my past experiences are relative because I am just a culmination of those experiences. So it's very much important for us to understand within ourselves that our pasts shape us. Our experiences are constantly shaping and reshaping and forming and reforming our sense of ourselves. And if we express our emotions and become accepted and validated, then we develop a good sense of ourselves, a sense of ourselves as a person who is worthwhile. But if for some reason those emotions aren't validated enough, or aren't validated appropriately, or aren't acknowledged, or we're too scared to express them so that we don't get the validation that we need as human beings, then those emotions don't get processed and we become conflicted with who we are. And that's the dynamic.
Oh, sorry. Yeah.
Go.
I was just wondering, would you, sorry, Dion, would you elaborate a little bit more on the fact that, like, the good emotions and the bad emotions, and yet we really don't have, they're in our bodies, so we don't have to discharge them. We don't have to let that electricity out. Can you talk a little bit about that? Because that's the other conflict, and that's what becomes bad, isn't it? Like, it's judged as bad. So could you
there are no
bring that
good
out?
emotions or bad emotions. They're just all emotions. And when we think that one emotion, because of language, we tend to sort of classify things and dichotomize things, and some emotions are good and some emotions are bad. The reality is that all emotions is just emotion. That's all they are. It's not anger is a bad emotion and love is a good emotion. You can't exist, you can't live in a world without love and anger. They are the opposite side of a coin. It's the same coin. On one side there's love, on the other side there's anger.
Exactly.
The people that I'm the most angry with are the people that I love the most.
Right.
The ones that I love are the only ones that can hurt me the most. And so I have every right to be angry with them when they hurt me. And it's not because people are malicious or intend to hurt me, the ones that I love. Sometimes they do it by mistake. Sometimes they do it because they can't give me what I want. So a natural response to that is to be angry. It's not a crime to be angry. You should be angry about those things.
Right.
Dion, the other thing though, when you're angry and you understand your anger, it covers you, it protects you, it builds your strength. And often when we see patients, they say, oh yeah, but I was always told never to be angry. Can you talk a little bit about that? That when you mentioned about being hurt, and if you're hurt, you're going to be angry. Could you sort of talk a little bit more there?
Yeah, if somebody hurts you, anger is a protective emotion. All emotions are protective. The old-fashioned evolutionary perspective on disgust. It was an evolutionary response to seeing something rotten in the woods. You were meant to feel disgusted when you saw that rotten animal sitting in the corner going, oh, that's not what I'm going to eat. It had a function. It had a purpose. It was a survival mechanism. All emotions are a survival mechanism. They mobilize us to move towards or away or to do something that's in our interests. Not just individual interest, but also the interests of our communities, of our families, of our tribes, of our societies. So if somebody hurts me or a family member or somebody that I care about, then what I'm going to feel is a response to try to protect and to right the harm that's been done. By hurting you in response, that's not going to fix it. That's just vengeance. And that's discharging the anger. That's not the same as feeling the anger. And because what I really want from the anger is I want you to understand what you did to me so that you learn not to do it to me again. That's what I want. And if I can't teach you that, then I get stuck with the anger.
And then when you get stuck with the anger, what happens?
I have problems. I get tummy aches. I get headaches. I get back pain.
And what about outbursts? What about outbursts? Outbursts of rage.
Discharge is
a good word, discharge.
It's an ineffective way of trying to get an outcome that isn't going to achieve what the emotion is about. A discharge of love is not the same thing as being loving. Discharges of love, men or women can, justify infidelity by, I've just got so much love to give. Well, that's a discharge of love because our emotions are not designed to hurt other people. Our emotions are not designed to hurt us or other people. So when we act on those emotions in a way that hurts, then we're discharging.
Yeah.
Do you think,
Thanks,
I mean,
Dion.
like, what do you think about this, Rose and Dion? What do you think about this, the listeners?
I love it.
Thank you. I thought you would. I knew you would. I knew you would love it. That's why I said it. Listen, wait, listen to me. This is so interesting. Like, because I just want people to get better so much. What if we felt what we felt, when we felt, how we felt, and we just took responsibility for it? I'm responsible for my discharge, for my feeling, for my fidelity, my everything. I'm responsible. And I'm not going to blame myself. I am what I am. I did what I did. I'm responsible. It's like radical responsibility, radical acceptance. I mean, this is another tool that I think, over the years I learned from Sarno. Just, I'm responsible. And when I'm responsible, I'm really in control by being responsible and kind of letting go of the judgment. No one's to blame. And I'm responsible. Could that be like a take home, like to try to answer to each inner belly call, as the gastro speaks? Okay, I'm responsible. I can handle anything that happens. I think one thing that helps me with my patients is when they're upset about feeling this or this or this, I say to them, do you know you can handle that? You can handle the bellyache. You can handle one more. You can handle it. You're strong enough. And I don't think they believe that, about themselves. So we're back to loving ourselves. We're back to accepting ourselves. And it's unbelievable that chronic pain can be decreased by loving yourself. Is it that simple? I sometimes say to myself.
Well, it's not really.
I know.
It's not so simple, unfortunately. Dion, would you just elaborate a little bit about what Tova just said? Because the ability to turn back and have a view of ourselves is impeded because of the fear of self-reflection. Can you just sort of describe that from a patient's sort of perspective and as a therapist's perspective? Because it's very interesting and it's very common, and it's probably one of the biggest problems with chronic pain, that it's so hard to actually accept ourselves.
I think the kind of radical acceptance that Tova is referring to is the idea of being able to accept that I am responsible for everything that happens inside my body. I am responsible for everything that I feel. And there is nothing wrong with me feeling the way that I feel about this situation or this situation or whatever it is. But I also know that I can't control and be responsible for everything that happens outside of me. So if I can accept that I can't control everything outside of me, that I can't get every need met or I can't meet everybody else's needs, but that I can accept anything that I feel about that, then it's a whole different kind of ballpark then. Then we don't have to suffer. Then we don't have to become conflicted with the nature of the world. We can't control everything that's going on in our lives, but we can, accept everything that we feel about that. And if we can do that in a way that we don't become conflicted with ourselves, then we have a lot more compassion for ourselves, a lot more understanding of ourselves, and a lot greater, like you say, Rose, the ability to reflect on how we feel and how we fit into this world And then it doesn't have to feel like such a hostile place to exist.
So true.
Often, though, when someone comes to us and that desire to self-reflect, when they want to do that, they then go to cognitive disruption. Can you just sort of go to that space about how we've got smooth muscle anxiety, which is your area that we're talking about, but out of that, when the pressure builds up about self-reflection, then the cognitive disruption comes in and blocks us. So can you talk a little bit more?
When we begin to reflect, or when we begin to sort of look inward and to try to process, internal emotions, internal states that we have, been either not encouraged to look at before or decided that we couldn't deal with at the time because it was too overwhelming. When you sit with a therapist who's encouraging you to look inwards, to be self-reflective, and you start to do that, and it starts to become frightening, it starts to become anxiety-provoking, we begin to manifest anxiety in 3 different pathways. There's the voluntary muscle pathway, the striated muscles. Striated muscle cells are a very particular kind of muscle cell. There's the involuntary muscle pathway, and they're primarily made up of what we call smooth muscle cells. And they also have a very different structure anatomically to striated muscles. And then there's what we call the cognitive or perceptual disturbances. And so the anxiety or the stress of looking inward and being self-reflective can manifest itself in either of those 3 pathways. And what we're doing when we're sitting with people, examining their internal experiences, their internal world, is we're looking for signs of which one of those 3 stress pathways or anxiety pathways is activated in any given moment. When I was talking before about the example of the person that I'm working with, I'm talking to them about some kind of experience, and they start to hear some stomach rumbling or some gurgling, and they start to belch or get gassy. That's an example of smooth muscle cell activation. So the smooth muscles in the GI tract, and the GI tract is primarily made up of smooth muscles. It's an involuntary muscle. You don't have to physically tense up in order for it to function. Peristalsis occurs without us having to do anything. It's
automatic.
Yeah, it's part of the autonomic nervous system. So we don't need to do anything to make it work. But what happens when we're stressed is it can overwork, and it can start to overwork itself and become, tense and tighten up. And when those smooth muscle cells that don't have a very strong cell wall become too clenched up, they release some of the fluids within the cell walls, and that causes bleeding and fluid to leak out of the stomach or out of the GI tract. But once we go past that point, and once we sort of hit a point where that level of anxiety is elevated, we start to experience problems with our ability to think or our senses. So we begin to feel foggy in our heads, or we can begin to feel a little bit drifty and not follow not be able to concentrate and not be able to attend to the conversation, lose track of time, or we begin to get disturbances with our visual field or our auditory hearing, and we can start to experience those kind of symptoms very easily during the process of self-reflection. And everybody has a limit. Every human being has a limit. And when you hit that limit, that's what it looks like. We begin to break down in that way.
Wow.
Yeah.
So
Thank you.
I wanted to respond. I wanted to just comment, Dion. So when we're anxious or stressed, our body reacts.
Yep.
I mean, that's basically what Dr. Sarno.
Automatically.
It's like, right. And the muscles, and is that the fight or flight mechanism that's reacting, and then the muscles react, and then.
Yeah, fight, flight, freeze.
Right.
Yeah.
So there was 2 questions. I first wanted to respond to Sherry Smith Norton, who I'm happy to see you. I haven't heard from you in a while, but I'm happy to see that you're on the show. She says she totally gets it. She's caused diverticulitis and GERD, so she's taking responsibility, that have both put her in the hospital. Now she knows it's stress, and she's working hard to not have it continue. I mean, it's like all the honor, Sherry. You are being your own doctor. because you're aware that you're the navigator, you're the conductor. And so now when your belly hurts, you won't be freaked out. I think that's part of it, is the fear of the fear. So Sherry, I'm thrilled to hear from you, and we are all here to help you. Mia asked a long question that I want to put on up for you to look at, because she would like to hear from you, Dion. How to know when it's negligent? This is a good question. When it's negligent to not follow Western doctors' recommendations, and when not to. I don't follow anything they suggest because it's scary and doesn't feel right. Operations tube. She's focusing on TMS and wants to trust in 100% that. But she's worried that things might get worse and not listening to doctors. I guess this is holding her back from believing 100% in TMS. She's from Switzerland, Mia. It's too much to answer here, but maybe Dion can directly answer this. This is a tough one, because we're not here to bash doctors. We're not here to bash medicine. So why don't you go ahead and
we're all just using the tools that we've been trained to use.
Yeah.
I think the answer depends. It depends on what else have you tried? What else have you done to deal with or to identify what the origin of the symptoms might be? Whether your symptoms are an eating disorder or whether your symptoms are a pain problem in your body. What have you done in order to try to get to the core, the engine of what's causing the symptoms? The stress is just an indicator that there is something going on that is not right. So what else have you done to try to get to the cause? What work have you done in that area? Have you done the self-reflective kind of process that Rose is referring to? Have you done something to try to look at what the impact of, say, childhood trauma is having on you today? Is that something that you've been able to address? And if so, have you been able to do it effectively? Because there's different ways of addressing it. Some are, effective ways of addressing it, and some are sort of like just, touching the edges. To go into, to childhood trauma, for example, and to be able to reprocess things and to have what's referred to as, we call it in the trade, the corrective emotional experience, to be able to have that. If you've had those things, but you've still got your symptoms, then you can weigh it up. Well, I've done the work on my emotions. I've done the healing internally in that way, but I still have the medical symptoms. Well, then, the common sense approach would be to say, okay, the medical thing is still something that needs to be considered.
But again, chronic pain is not normal. It's not
That's
something
right.
we have to live with. And again, even if we have something physical, the way we react to it is our responsibility. And we're learning now more and more. If anyone wants me to send them on the message, we're looking at x-rays with disc, we're looking at MRIs with disc herniations, and patients are not in pain. So these tests are not always an indication that something is wrong. It's simply an observation, and we look at it and we put it into perspective. And again, the body and the mind, it's not all or nothing. And I think the doctors are doing their job the best they can. They're trained to give you a diagnosis and to fix the problem. We're trained to fix the problem, but we're trained to get to the cause of it, because we want a thorough, complete healing.
Well, can I just sort of say the difference between the medical interpretation and the psychological interpretation is that the medical interpretation looks at the symptoms, but we look, as Dion said, at the cause of creating those symptoms.
Right.
Because unless it's, say, genetic or something like that, there is always going to be some sense of fear or loss of control within those symptoms.
Right.
So if we look at why we've got a problem with loss of control, why we've got a problem with fear, then the symptoms don't have a job anymore, so they can go home and rest.
And I think one of the things that that is important to reiterate here is that, I've oversimplified it. Absolutely. This is, dealing with the emotions, I make it sound very simple, but the reality is it's not, because as much as I've been sitting here saying, emotions are just natural, we're meant to feel them, don't be scared of them, embrace them, what our minds have also developed is not just, instructions or advice from other people about what's right and what's wrong, what's good and what's bad. But in the process, we've also developed our own defensive system. That is, so think of it as a castle. Around the castle is the wall. The defensive system is the wall. It's designed to keep everybody out and to only decide who you want to let in, who you're going to share that really intimate space with, and, not everybody wants to share it with people. I don't want to share my intimate space with just anybody. Do you even want to share it with your therapist? We develop our own mechanisms to make sure that we protect ourselves because we've been hurt. That's the point of the defensive system. It's there to protect us. But it was there to protect us at a point in our histories when the pain occurred. But it lives on. And so then we've got, when we suffer from pain, when we suffer from problems, we're also doing it to ourselves without realizing that, because we put our own mechanisms in the way to protect ourselves.
Right.
But then over time, it's no longer protective. It's keeping things in. It becomes a prison.
Right. It's like there's two women who are talking about how they're just in discomfort 24/7, and I just want people to have hope, because it becomes, like you said, a cycle, and they're going from one end to another. And I wanted to give an analogy about the balance of if we could look at life as like the pendulum is just swinging to the right and to the left, and I'm feeling terrible 24/7, I'm having chronic pain. Well, we've got to get to balance. So for you women who have been suffering for so long, first of all, do not give up. I know Rose and I are relentless about helping people. So, but if we want to help you, but it's hard work.
Okay.
It's hard work, but don't give up. And think about balance. Think about somehow everything you do in your life, try to bring it to a sense of the pendulum like this. Because all your life.
But Tova, ask them, what do they think their own barriers have become?
Yes.
Okay, so so Linda and Mia are asking. They want to know what they should do. What they're not doing the right thing, because it's years and years that they're suffering. What should they do to heal?
It's not that they've been doing the wrong thing.
Right.
It's just that probably nobody has explained to them that you've got your own barriers, that you've developed your own barriers, and that you may not even know what those barriers are and how they operate. And those barriers are what's keeping you in pain.
Locked. Yeah.
Okay, so how did they get? Okay, I'm role playing with you. Well, then, how do I get through the barriers?
What barriers?
How do I get through the barriers?
What barriers do you think you have?
Okay, I have a lot of them. And how do I get the walls to come down?
So I don't get your walls to come down. Only you get your walls to come down.
Well, how do I do it? I'm tired and I'm scared.
Of what? Of what's inside you? Well,
then
you're going to keep your barriers.
I'm so used to being in pain. I'm so used to being in pain.
Well, that's the problem of your barriers.
Right. Is it a letting go? Is it kind of a surrender? Last week, Eddie Lindenstein talked about a surrender. He submitted to some. Remember, Rose, he submitted. Yeah. Like he surrendered. And I think that's what you're saying. We're holding on. We're protecting. So yeah. I know I will.
He took his walls down.
Right. And I would like to share that one therapist said to me many years ago, tell the little girl inside of you, tell the little boy inside of you, you don't have to protect me anymore. You did your job. You did a great job to protect me when I needed it. And now I don't need you anymore. I can handle it. And I think we're back again to self-love, self-acceptance, that's what we're back again. And it's
That's self-responsibility too.
yeah.
Mm.
Yeah.
Yeah. I think that in a way that scenario, having the doing the role play that when we first started of, you know, saying to the boss, well, I deserve a pay rise, and then the pain comes. We then can if we unpack that, we've got the whole scenario of our lives of deserving more, deserving better. But as soon as we recognize that we deserve better, we then
What if
turn
your
in
boss
on
doesn't
ourselves.
think you deserve more?
That's right.
Then you've got the
Yes.
problem of, but I think I deserve more, but you
Yes.
don't think I deserve more. Who's right?
That's right. But
Nobody's right or
when we have
wrong.
the
Nobody's
pain in
right
the
or
stomach?
wrong.
Yeah, but the pain in the stomach comes up.
That's right.
Yeah,
Because
and then
I don't feel like you value me. So I get angry with you and I feel hurt by you, but I don't
yes,
have a way of being able to experience, you know, to deal with what's happening
express
in me.
it.
Right.
Yeah.
Excellent.
Yeah.
Excellent.
Yeah.
Tamara
Yeah.
Bell, this is a great question because I ask this over and over again. And don't ever be scared to ask a question. A question is never stupid. Please always ask the question over and over and over again. This is a great question, Tamara. She says, I feel this sounds like a dumb question. It's not a dumb question. She wants to be able to understand the difference between thinking and feeling an emotion. It's an excellent question. Can you answer that, Rose, and then Dion?
Oh, well, Dion, answer
Dion
it.
and Rose, go ahead.
Yeah, thought is cognitive.
What is the word cognitive? Explain that. Cognitive.
It means it's a thought. It means that I identify what I'm feeling in my thought. I call it an emotion. I use a word. I use a label. So the emotional experience, a whole emotional experience, is made up of a number of different components. And just very quickly, you know, there is the cognitive component, the labeling of the experience. Then there is the somatic part of the component, and that
somatic
is
means body.
Felt. Yeah, that is the felt, the bodily experience of the symptoms. It's like when I feel enraged, I get hot, I get energized, I get charged up, and I get more aggressive in my demeanor. And then there's also an action, and that is what it drives me to do. It's the impulse associated with the somatic experience. And then the last part is that there's also memories attached to other experiences of anger that help me understand what I want to do or how I want to do it or what I want to achieve and how it went last time when I did it this way, how it went last time when I did it that way, and what's the effective way of being able to achieve my goal. And those four components are what we think of as a whole emotional experience. Whereas just thinking or just labeling it as anger is just one part out of the four.
Good, yeah.
Wow.
Linda asked about guilt.
Yeah.
And could you sort of talk about conscious guilt and unconscious guilt, and also about the shame that covers the guilt?
Yes, self-blame, shame, embarrassment, humiliation, they're just forms of what we would say are self-attack for the things that we have the guilt about. I'm too embarrassed to face that person. I feel, you know, that I should go home and I don't deserve to eat because, you know, I said the wrong thing in front of that other person. These are the things that we do to punish ourselves for the things we've got the guilt about. In terms of conscious and unconscious guilt, it's just what you're aware of. I'm aware that I feel guilty for something that I said to my wife the other night, but I'm not aware of the guilt that I feel about wanting to, you know, hit my parents when I was a little boy because they didn't give me something, because it's sunken into my memory where I don't remember it at the top of my mind. And guilt is a really healthy emotion. It's the most healthy emotion. It's love. Guilt is love. Guilt is I feel bad because I've hurt you, because I care about you. So guilt is one of the most important things for us to learn to be able to handle.
Wow.
You know, I'm trying to teach my 6-year-old daughter to feel guilty. Yeah. Am I an abusive parent? I just want her to feel the guilt in a healthy way.
Wow.
Yeah. And be able to say sorry or whatever. Yeah. But when we are ashamed of our guilt and it shuts us down,
then we're attacking ourselves for the thing that we have the guilt about.
Right.
Yeah.
And that's not the same thing as guilt. Guilt makes me want to
No.
apologize to you. It makes me want to make it up to you. It makes me want to say, I won't do that again.
Right.
Yeah.
Excellent. I never, in all my so many years, looked at guilt that way, Dion. It's
Yeah, guilt
brilliant.
is not shame.
No, and it's about the balance of emotion. Nothing is bad, nothing is good. It's just the balance. And
Yeah. If you've hurt
Like
someone,
breathing.
you want to
You breathe
repair.
in, you breathe out.
right.
Yeah.
I wanted to honor Sophie Van Dyke. Mentioned a few things. First of all, very clever. She says that she's journaling now, but she's trying to surrender and not care. But she can't not care. And what I want to say to Sophie is it okay to not care? It's okay to care and not care. Don't judge yourself caring or not caring. It's all okay. You can care while you're journaling, and then you can not care. Does that make sense? Someone explain to
But
Sophie
if she's
what I just
having
said.
difficulty not caring, then that's something inside her telling her that she's a caring person.
Right, but not to judge
So feel the guilt.
not to judge herself. And then Sophie goes to say, because Sophie is so smart and sensitive, are we in pain because we are not living authentically?
Yeah.
And I think that's the most powerful thing that could be said. And what is authenticity, Sophie? Knowing ourselves. Pain is an incredible, powerful lesson in knowing ourselves. And you're on the right track, Sophie. You're on the right track. What do you say about authenticity? It's so powerful. There's a beautiful YouTube that I'll send to anyone who asks me, remind me, where Dr. Gabor Matai is talking about if you're not authentic, you will develop an autoimmune disease because your body will attack you. And his book is called When Your Body Says No. It's very, very powerful. Very powerful. There's some new messages below. Rakreka. Okay. Yeah, Sophie's saying she doesn't know. We're all knowing ourselves. Yeah, I think the ego is something I'd like to just mention. I know that sometimes we have an ego because we expect to get better and we're not better. Because we're not realizing that this is a journey and we're taught, to get to be, and that's all about, back in the beginning of the comments, Dr. Sunita Merriman was saying how our emotions we have them and they're sort of stamped into us at a very early age. I have to be someone, I have to do something, I have to act some way. So already we're trying to undo ourselves and just to be ourselves. So it's a journey, and I want everyone to be on this journey with us from the beginning to the end. I don't think it's lower the bar of expectations.
Yeah, that's got a lot to do with the ego. And maybe Dion could bring that up a little bit or explain it a little bit better, how the ego, which is supposed to be part of our persona in public, becomes punitive. It becomes cruel and it bites into the person. And the pain, maybe you could see it as a forceful way of attacking. Yeah. Could you elaborate a little bit more?
The values, the morals, the superego, the moralistic center of our, conscience tells us what's right and what's wrong. It's kind of like passed on through our DNA. It's reinforced with our, interactions with people. And we're constantly trying to, we're not all sociopaths, very few of us are. But we're constantly trying to improve ourselves and to know ourselves and to be liked and to love people and to love the people that we like and to be loved by the people that we just want these interactions to be bidirectional. So we're trying to, be good people in order to achieve that. And then what we do is if we think that we've broken the moral code is we punish ourselves because we know that we've broken our moral code. If we talk to our doctors or to our family or to our friends about the things that we're most guilty about, that's when we're actually freed by it. But until we do that, we're the only ones that know, and we set, we become the judge, the jury, and the executioner of our own moral codes and standards.
Mm.
Wow. Excellent. Excellent.
It's sort of like we've got these, how would you, Alan Abbas calls it the dead anger that's sort of sitting in our guts, that needs to be released and allowed to be what it is. Is there a way of putting that succinctly? That's, that whole idea that year after year after year, the bully at school that you were talking about, the overprotective mother or the underprotective mother, all of that anger is just still sitting in us, isn't it? The rage about that. And then when I go to my boss and ask for a pay rise, I'm really enraged because he doesn't see the good value in my life. Yeah.
So he just becomes a person that is the same as the other people who didn't recognize the value in me. And I'm either going to say, yes, I have no value, you're all right, or I have value and you're all us, you're all...
It's not all or nothing. It's that you go into the meeting with your boss expecting just to get out of the meeting. He'll say, it's more like how we react, or let's respond to the person we feel angry. Let's respond and not react. Respond as we stop, we breathe, we think about, I know it's not so easy, but we're learning new habits. We're all teaching our clients and patients new habits.
Well, it's about justice as well. And when we hold on to justice, because Dion was talking about our moral compass, and we expect justice to happen. And like right now in the world, there isn't much justice going on. So, of course, we're really outraged about that. So when we go in to see the boss and that you've done a really great job, and you've done 110%, and then the boss negates that by saying, no, the butterflies in the stomach come up because it's unjust. I'm getting tongue-tied.
Injustice.
Yeah, because there's huge injustice in that.
Or I can feel sorry for him that he hasn't opened up his heart and mind to see that I'm such a good worker. And I could have compassion for him and be like, I guess he doesn't really know what a good worker is. And I'm going to go prove myself somewhere where I can be appreciated.
So it shows us that so much of this is based on our interpretation of what we deserve. But where does the idea of what I deserve and why I feel what I feel when you don't give me what I deserve, where does that come from?
Right.
That doesn't just come because I go to the boss and I say to him, I would like a raise, please. Here is the reasons why I believe I deserve a raise. I work very hard for you. I work many long hours. I don't put in extra overtime. I get good results. I get better results than anybody else on the floor. And I know that you just gave Dave next door a raise of 5%. So I was hoping that maybe you could give me something similar. And then the boss says, oh no, well, we gave all our extra money to somebody else and we don't have any left in our budget for any more increases. And I walk out and I feel enraged. It's like, well, is it just because of that one-off situation? It might be, but it may not be. What other kinds of injustices, what other kinds of invalidations were there in your life? And most often, like I can see Linda's asked a question there of how do you awake the dead anger? Well, it'll happen in an interaction with somebody. And then you just got to...
That's right. Well, that's exactly what...
And then what do you do with it? When it's awoken, what do I do with it?
Dance with it.
Dance. Linda, exactly. And go ahead. And then what? And then because I'm not used to dancing with it, then what?
Yeah, to let it move around in your body, to follow it in your body and to stay present with what's going on physically in your body and mentally in your mind, and to stay awake, to stay open, and to try to just allow yourself to experience what's happening in a way that you don't become scared and anxious and tense and shut down and sore stomachs or sore pain in the butt or, nauseous, and just to try to hold the experience. And that may be something that you can't do straight away. It might be something that you need to build up to.
It's a habit.
But it's just repeated exposure. It's the good old sort of,
Repetition.
Don't stop doing
for
it.
me.
Repetition.
Yeah. Don't stop doing it just because it's uncomfortable.
Right. So it's like go with
do it if it's uncomfortable,
go
really.
go with the discomfort. Feel the fear and do it anyway. Dion, I'd love you to give our listeners, and maybe someone will write this down, like 3 take-home tools. I know this doesn't happen overnight. This is not like a fast food body, mind, emotion show, but the tools are the same, and it's about repetition. And we're human, so we regress and we go ahead and we go back. We are human. It happens to all of us. No one is immune to a really bad bellyache. No one is immune. The stomach is no one is immune to this. We're all so. Repetition is a key, but give us a couple of take-home tools, regarding what we talked about tonight.
So first one is work out what kind of anxiety you're experiencing at any moment. Do you have the anxiety in your voluntary muscles? Are you starting to feel, keyed up and energized and having to sort of bounce around and squeeze your hands and, take deep breaths, Or do you start to get the stomach pains? Do you start to get the nausea? Do you start to get the headaches? Or do you start to feel a little bit drifty? Do you start to feel a little bit sort of, lose concentration? What kind of anxiety are you experiencing when you're focusing on something, when you're trying to heal? What kind of anxiety am I experiencing in any moment? And try to hold it in the striatum, hold it in the voluntary muscles. And if you can hold it there, then that's going to make it a lot more comfortable for you. It's still going to be uncomfortable. Like Tova said, go to the discomfort. Rose said, go to the discomfort. But hold it in the voluntary muscles if you can, because it's a lot better for your body to be able to hold it that way. Then the second thing is get to know your barriers. What mechanisms do you use that make it hard for you to look at what's going on in you, and what the relationship between those barriers and your anxiety is? They're my 3 tips.
Excellent.
Very good. That's a lovely way, succinct way of saying it. Thanks, Dion.
Wow, amazing.
Yeah.
I'm already going to invite you back. And we'll try to change the time so it's 9:00 in the evening, Australia time. You guys are amazing. You're my heroes. Waking up in the morning.
Next time.
Thank you, Dion. Yeah. We'll respond to any questions on the side that we haven't responded to. Yeah. And also afterwards, even on Facebook, if you make a comment further down the track, it will highlight for us and we can respond.
Yeah.
So also thank you, Dion. I'd like, before we finish, to just have a few moments again to remind ourselves about our bodies. Because, we spend all our time in our mind, and in actual fact, we've got a body that goes with that mind. So again, I ask you to quietly observe your body. Observe it as a whole right now. Just see it from the top of your head right down to the tip of your toes, all the way up and down. Acknowledge it. It's held you in good stead. It's reminding you of your suffering, the emotional suffering that's going on within you. And also think what's happening within your abdomen, within your stomach right now. You've got reflux. Observe it. Allow it to be there. And soften your body around it. As Dion said, go through it, go within it, and allow yourself to see what your barriers are to acknowledging yourself. And find peace within yourself. Peace within those muscles, those voluntary muscles that are tense. Notice that they are allowed to have their say as well. And thank you all for being with us in this hour. We have another doctor coming next week and the week after that will discuss various aspects of our bodies. And thank you, Dion.
Have a great day. Thanks, everybody. Lila Tov, good night. See you next week.